Our professional this week is Lerato Mohale. Lerato is a young lady from South Africa who is a qualified social worker, currently completing her master's in clinical psychology. Lerato will talk us through her journey to becoming a social worker and a day in the life of a master's student studying clinical psychology. If you like this video, remember to hit the like button and subscribe so you don't miss out on our amazing series. Remember to share with your friends, as this could be helpful to them as well.
Hi there, I'm Lerato Mohale. I am 28 years of age. I was born in the Northwest Province and then later moved to Gauteng Province. I'm a qualified social worker and I'm currently completing my master's degree in clinical psychology. I'm doing my second year, which is also called M2. I found out about the career of psychology when I was in grade 8. There was a day when we were presenting about what we wanted to be when we grew up. And I remember one of my friends presented about wanting to become a psychologist when they grew up. At the time, I did not know what psychologists did, and she mentioned that psychologists deal with the human mind, and that fascinated me. And I also thought, because psychologists work with people and I also would love to work with people, I'm a socially inclined person, I also had good marks in social sciences. I thought, okay, this is in line with my scholastic strengths, so I should look at pursuing this career. I went to Klapgat High School, which is in a township called Klapgat in the Northwest Province. I chose the subjects that were in the science and math stream. They included mathematics, physical sciences, geography, life sciences. I did Setswana as my home language, and then English as my first additional language, and life orientation. There are different factors that influenced me choosing those subjects. Firstly, as a black child who came from a black dominated lower and middle class community, I did not have proper career guidance, and even today I don't feel that those are the subjects that worked in my favor. Secondly, there was this social notion that doing the science stream places you at a better advantage of choosing a more prestigious degree compared to other streams. So yeah, there was this social pressure for me to pursue this stream. Post-matric, I definitely benefited from geography, especially the parts of settlement geography. As I was studying social work, I could see the link between where communities settle and their socioeconomic status, and how it can impact their societal well-being. As well as now in my psychology field, I can see how the societal conditions of an individual can influence their mental health. Additionally, life sciences worked in my favor, especially on the biology part. Like right now, I'm going to be doing neuropsychology modules, looking at the brain, its functioning and its pathology. After matriculating, I was accepted at Northwest University, Mafikeng campus. The reason why I went to NWU, Mafikeng campus, was because I had only applied at NWU for psychology, and I had also applied at TUT for environmental science, but because I had not passed my maths well, I am not numerically gifted. I could not be accepted at TUT. So I had to go to NWU, and I was happy with it because honestly, I was into the social science courses. I did my first year in psychology, and then during the year, I found out that actually for one to become a psychologist and start practicing, they need to complete masters first. So because at NWU you could have your main course or program of study, and then you could have a secondary majoring modules. My secondary majors were social work modules, so I made an informed decision to switch from psychology to social work so that I can complete social work and have a qualification and then go back to psychology, but having a ground of a qualification in case I don't make it to masters on time or in case life happens. So that's exactly what I did. I went through social work as my main course, but with psychology as my second major. I graduated on record time, and in 2016, immediately after finishing my Bachelor of Social Work, I was already doing my honors in psychology as I had promised myself, which I completed in 2017. The nice thing about my journey that I pride myself in is that when I got into tertiary and started doing what I was scholastically gifted in, I graduated for my social work degree with distinction, and then I graduated for my honors degree with distinction as well. I did my honors degree at Sefako Makato University, previously known as Medunsa. I was lucky enough to receive funding for all my degrees. During my social work years, I was funded by the Department of Social Development, and during my honors, I was funded by NRF. And last year, during my first year of masters, I was funded by the GCRA bursary. So the day in the life of a clinical psychology master's student involves waking up, preparing for a contact class between 9 and 12. Once that class has ended, I have a practical component to my program, whereby I go to the hospital on Tuesdays and do practicums there. So my day on Tuesdays involves going to the hospital, and the first thing we do is to check in. As psychologists, we are big on emotions, where you are at the day. Are you gonna be able to go through the day? Are you in the right emotional state? Do you need support? And if there's any support that you can receive, you be given that support so that you can get ready for your patients. I am in the medical ward rotation. So in my rotation, we go to the medical wards. For now, we are specifically placed in the trauma unit. We have the medical ward rounds, mainly with medical doctors, whereby we go to all the patients that are in the ward from the first bed to the last bed. Mostly the medical doctors do the talking. They discuss the medical conditions of the patients, and as we listen and go through the patients, we can determine which ones might need psychological interventions. While they are in the ward, in that cubicle, we sit next to them. We have that clinical interview. We have that initial session, and usually you have a meeting with your supervisor, and they supervise you on the case that you had in the hospital. We can arrange with the patient for a follow-up session as an outpatient. So the patient will come back to our outpatient department, where we will continue with our therapy there. And once we've had that in-depth initial clinical interview, we can also look into if, in addition to therapy, a patient also needs maybe psychological assessment or maybe psychological screening. We can also do that. We can quickly screen for depression, anxiety, and maybe trauma. And maybe we can also look into if a patient needs a psychological assessment, such as an IQ test. We can do that, or a personality assessment. We can also do that. And maybe in addition to a diagnosis, we also refer, for instance, maybe to a psychiatrist who can prescribe pharmacological treatment for the patient. What I like about clinical psychology is that it gives us an opportunity to alternate between roles so we don't get bored. You can alternate between being a therapist or doing psychodiagnostic assessments or even doing research. You can also work in a psychiatric hospital. You can also work in other mental health institutions. You can also work in the corporate world. It gives you so many other options. On the flip of the coin, our roles are really demanding. Therapy is demanding and it can really drain you and tire you. And on the other hand, psychodiagnostic assessments are also tiring, and their reports, the reports that we need to write after that, they are also really demanding. And in most cases, you end up taking work from work to home, so the work really doesn't really end. The starting pay for psychologists, from my knowledge, is around 37,000 at this point. In conclusion, my advice to you is that capitalize on your scholastic strengths and then couple that with the demands in the job market. It would be so unfortunate to follow your passion and your talent, however, them being not relevant in the current job market, you not being absorbed in the job market. I thank you and I wish you all the best in this academic journey. Bye.